Wolff-Parkinson-White syndrome ECG pattern. Before proceeding, we will see components of ECG, PR interval, P wave, and PR segment. These both constitute PR interval. QRS complex, Q wave, R wave, S wave constitute QRS complex. And this red denotes PR interval, blue denotes QRS duration. A normal PR interval is 120 to 220 milliseconds. A normal QRS duration is less than 120 milliseconds. A normal atrioventricular impulse transmission. SA node, right atrium, left atrium, AV node, bundle of Purkinje fibers, both ventricles. In Wolff-Parkinson-White syndrome, there is an accessory pathway which is called bundle of Kent. It causes pre-excitation. This pre-excitation can be seen on ECG as delta wave. Delta wave is a slurred upstroke before QRS complex. Due to this delta wave, there is shortened PR interval and prolonged or widened QRS complex. You can see this is PR interval in normal ECG. This is PR interval in Wolff-Parkinson-White syndrome. This is QRS complex in normal ECG, and this is widened and prolonged QRS complex in Wolff-Parkinson-White syndrome. So in Wolff-Parkinson-White syndrome, there is delta wave, shortened PR interval, widened QRS complex. Before proceeding to this slide, remember that one small box on horizontal or x-axis is equal to 40 milliseconds. This is normal ECG. This is QRS complex. QRS complex in this normal ECG is less than duration of 120 milliseconds or less than 3 small boxes. And this is Wolff-Parkinson-White syndrome ECG pattern. Here QRS complex is more than 120 milliseconds or more than 3 small boxes. Here is delta wave, slurred upstroke. And this is ECG of Wolff-Parkinson-White syndrome. Here you can also see shortened PR interval, widened QRS complex, and a slurred upstroke after P wave. Wolff-Parkinson-White syndrome can cause reentrant tachycardia. Here is accessory pathway. Here is AV node. Impulse travels from AV node and then through this accessory pathway re-enters into atrium and cause reentrant tachycardia. Atrial fibrillation is the most common complication of Wolff-Parkinson-White syndrome. Here you can see atrial fibrillation. Atrial fibrillation has irregular heart rhythm, tachycardia, and polymorphic QRS complexes. Here are intervals in successive beats differ in duration, so rhythm is irregular. Heart rate is obvious that there is tachycardia because RR intervals are too close to each other. And there are QRS complexes of different shapes. These all represent atrial fibrillation. Atrial fibrillation is the most common complication of Wolff-Parkinson-White syndrome. That's all. Thank you.